Surrogacy is a medical procedure whereby a woman carries a baby that belongs to another individual or couple that wants to have a child. The reason as to why a woman acts as a carrier is due to the original mother having complications to conceive, such as having a malformation in the womb or failures in conceiving through IVF treatments. Due to these reasons and complications, a surrogate mother is introduced to hold the baby for 9 months themselves. There are two different types of surrogacy procedures that can be undertaken, and the first is called traditional surrogacy. This form of surrogacy is the simplest and least expensive option. A traditional surrogate is someone who is genetically linked or related to the child that the surrogate mother is carrying. Additionally, the fertility clinic provides a semen sample, and if not, a sperm donor is used. Gestational surrogacy or host surrogacy is the other form of surrogacy where eggs are used from either the mother or a surrogate. This option is more complicated as well as more expensive. Mothers who go through gestational surrogacy have inhibiting factors to conceive in their own womb, such as the absence of a uterus, a hemorrhage, prone to miscarriages, and have a severe heart rate. The first step is where the female producing the egg, known as the egg donor, goes through a number of treatments to extract a group of eggs from the uterus. Next is the process of fertilization, where the female egg is fertilized with semen in the medical laboratory. Lastly, the fertilized egg is then transferred from the medical lab to inside the womb of the surrogate mother. The issue of surrogacy falls under bioethics, as it can be supported by the bioethical principle of autonomy. Autonomy is the acceptance of patients' choices due to the belief that they have a right to do what they want in the ethical perspective.
Surrogacy has proven to be an advancement in the medical sector of society, as it breaks the gender and infertility barrier of not being able to have a child. Every individual should have the right to be part of a family and in turn have a child if they wish to follow that path in life. However, if one is facing difficulties following their desire to have a child of their own, surrogacy becomes a viable option for many. The primary bioethical principle out of the four in the healthcare settings that is central to the issue of surrogacy is autonomy. This bioethical principle highlights the application of free will individuals have the opportunity to. Autonomy in healthcare context emphasizes the capacity of a patient to develop an independent decision without the involvement of any other factors, such as health professional advisory and the perception of their decision by society. This bioethical principle encourages the process of surrogacy, as it is an individual's personal preference whether or not they choose the genetic material to be fused within another individual, particularly if they experience difficulties in cooperating in the process themselves. Furthermore, autonomy is also involved in the surrogate's decision, as they are at liberty to do whatever they choose to do with their own body, as long as they are not coerced into the decision by any means, for example, payment or bribing for the process. There are many reasons as to why surrogacy should become more prevalent in society, such as presenting families with fertility difficulties and opportunity to expand their family, homosexual couples who wish to have a child with at least 50% of the DNA from one of the members, and individuals who wish to raise a child independently. Furthermore, surrogacy dates back to primordial times, specifically in the Holy Bible, the scripture of Christianity. Genesis chapter 16 depicts the story of surrogacy, reaffirming that the Bible does not condemn surrogacy. Due to this, many individuals believe surrogacy is an appropriate course of action, as it has occurred in the Holy Bible. This philosophy strengthens one's desire to make an autonomous decision, as they become adamant on the idea that if surrogacy has transpired in the Bible, it can be applied to their own life. Nevertheless, the Bible does raise questions whether or not surrogacy involving a third party is ethical and moral. Furthermore, Buddhism is in agreement with surrogacy, as it does not place pressure on its adherents to procreate through the union of marriage. An autonomous decision can only be made if both the surrogate individual and the individuals who wish to fuse their genetic material to create a zygote understand the following factors. Disclosure. Patients must be presented with all necessary information that will aid them in making an intelligent and independent decision. Comprehension. The patient must be able to understand all information provided, which should be stated in terminology that is meaningful to the patient. Voluntariness. Patients must not be pressured or forced into making a decision or lead to believe they will become punished if they refuse to provide consent. And competence. Patients must be mentally and emotionally stable as they make an informed decision.
Although the practice of surrogate motherhood has become more common since the American College of Obstetricians and Gynecologists issued its first statement on this subject in 1983, it continues to be a controversial moral and ethical issue. There are two sides: those who believe that surrogacy should be permitted because such arrangements can be beneficial to all parties, and to prohibit them would limit the autonomy of infertile couples and women who wish to help them through surrogacy. Others believe that the risks outweigh the benefits. Autonomy is the principle that guides the protection of individuals across cultures and serves a crucial role in protecting research subjects. However, the exportation of Western bioethics to developing countries has triggered controversy regarding the principle of autonomy and raised concern about ethical issues. Western attitudes toward Indian gestational surrogacy tend to fall within two categories: those who view it as an autonomous decision-making that leads to mutually beneficial outcomes, and those who view it as a forced decision and the catalyst of exploitation of women in developing countries who need rescuing. However, on the contrary to many Western countries, commercial surrogacy is legal in India, and many Indian women have chosen to become surrogate mothers for Western couples. The main reason for couples choosing Indian surrogate mothers over Western surrogate mothers is that they are cheaper, highlighting how such a narrow focus on the principle of autonomy can easily obscure the deep injustice behind Indian gestational surrogacy, which when revealed exposes a full aspect of so-called autonomous decision-making. Also, closer scrutiny has revealed that many Indian women are choosing surrogacy as a basic survival strategy for obtaining access to food, shelter, clean water, education, and healthcare, suggesting that it's not an autonomous decision, but rather a forceful offer.
Within the principle of autonomy, there can be positives and negatives in relation to surrogacy. As autonomy is one's right to self-determination, it is positive in the sense that any person or couple wanting to use a procedure can choose for themselves whether they feel it is right or wrong. However, a health professional can use their own autonomous right to say if they don't agree and refuse to go through with the procedure. This then makes it hard for people to autonomously decide that they want to go through with using surrogacy to have a child, as there are limited health practitioners who would go through with it. Surrogacy has high medical risks involved, especially to the child. Infertility treatments such as surrogacy and IVF have high chances of leading to premature birth of the child, which is one of the leading causes of infant mortality in Australia. It is also high risk for the women carrying the child, as with any birth. This then leads to exploitation of women's bodies. Women who act as surrogate mothers experience all the normal physical changes and processes as normal pregnancies, but are not able to experience mothering the child after birth. This is seen by some as exploitation of their bodies, as they are made to carry the child for 9 months, experience the morning sickness, back pain and weight gain, then do not get the joy of motherhood. This can cause psychological issues for these women and is one of the reasons why health practitioners are against surrogacy. Surrogacy may be the last chance of hope for many aspiring parents who are not able to conceive naturally but still wish to have their own biological child. This is commonly the case when the man or woman do not have sufficiently working reproductive organs and are unable to conceive or carry a child. Surrogacy, although taking away the experience of pregnancy, still provides these aspiring parents with the feeling of having created their own child. Similarly, same-sex couples who wish to have their own child but are unable for quite obvious reasons are still given the opportunity to have a biological child, and also as close an experience of having a child as any other straight couple may. It takes away the feeling of being different from other couples, as they can have similar conversations relating to who the child looks like, and can have a sense of feeling able to live like any other family would with the chance of having their own biological offspring. Overall, surrogacy is a pathway to being able to reproduce, which is a lifelong goal for many people. Although there are many opinions opposing the procedure, It is a form of hope for those who cannot naturally produce biological offspring, and that should be reassuring rather than make them feel ostracized for it being the only option left to achieving that goal.
My team members and I believe that surrogacy in terms of medical and ethical research is permissible in terms of respect for autonomy and the religious views and clinical issues such as infertility. Although the principle of non-maleficence explores the potential harm surrogacy may trigger, after reviewing numerous amounts of studies and ethically provided resources, we are still strongly convinced by the autonomous rights of surrogacy. We believe one should have the rights as an individual to make a decision about choosing a surrogate to carry a child or a surrogate making decisions for themselves in order to give opportunity to a family that aren't able to conceive due to personal, medical, and religious reasons or beliefs. Should surrogacy be accepted as a social norm across all cultures?